We'd like to introduce ourselves. My name is Jenifer Kirk. My colleague Shannon Dressler. A couple of things to talk through just to give you context to who we are. I mean, obviously, I spoke earlier. PSCA board chair. I'm a school counselor, counseling curriculum leader. I've been in the profession for 25 years. I know that's shocking, right? That's a joke. Just laugh. Oh, yes, I know. And mostly, I want to say, like, I'm a child advocate. I've been in this profession for what is really a long time, but I have always been all kids all the time. No matter what we do, we got to do. And so that is my driving force. I'm on a couple of affinity groups with ASCA. I participate in PA Wins, Pennsylvanians for Welcoming and Inclusive Schools. I do that through my lens as a human, fighting for the rights of kids. I'm a consultant for both NPR and K-12 Guide. I do that with my LGBTQ+ work, as well as a general educational consultant. And I did appear on NBC Nightly News a few times during the pandemic, which was really cool. I got to talk to Lester Holt, very cool. And I offer that lens just to show you that it's always about doing everything we can to raise the voice of kids and ensure that they're heard.
So I'm Shannon Dressler, and I'm a school psychologist. I have been fortunate that for all of my 21 years as a school psychologist, I've got to work with Jen. We work in the same school district. We were at the middle school together. We're at the high school together now. So over the years, we have really formed a great partnership and just an awesome working relationship because our two roles, do so closely align working in the school settings. I'm also really fortunate. We have 4 school psychs in our district, so I'm only assigned to the high school. So I'm only at the high school. So again, that allows me to do this work that's so important to me even more so. And I know all school districts aren't fortunate with having that many school psychs around. So I am also on the ASP, the Association of School Psychologists of Pennsylvania. I'm on their executive board. I'm the secretary. I do a couple different things within the district. We have a No Place for Hate group, which I am a sponsor of. We also have a Stand Together group, which I think is pretty unique to the western part of the state, Allegheny County. It's a partnership through DHS and the Office of Behavioral Health. So they come out and train students to be advocates to eliminate and reduce the stigma associated with mental health and substance use disorders. So this group of kids then creates and plans school-wide projects for peer-to-peer education about mental health issues. It's kind of like the mental health training first aid kit. If you guys have ever gone to that, it's like a watered down version for students that they get. So that's an awesome group. I'm also part of the Urban Affairs Committee on ASK. Also Upstreet is an organization in Pittsburgh. They provide mental health services. It's currently just an online platform that they provide free services to students. So anyone across the state, across the nation even can access these services. They're certified counselors on the other end of these chats for students. It's awesome. And they are just within the next couple of months actually opening a formal building. So students will be able to come in person as well, but it's a great online platform. And then I'm also a member of the PALSAP.
I want to add, Shannon actually lives in our office suite. So she has an office in the counseling suite. So yeah. I mean, we literally see each other all day, every day.
Yep.
And we're very fortunate and we know we're privileged in that. So when you see it, we literally see each other every single day.
Yeah, the collaboration is awesome. Yeah, we have it in our awesome.
Okay, so we're going to go through a number of stats, things but warranted to have on the slides so that they're at your disposal. If you take this and want to use this, because we're going to get to the practical application of our reentry plan and how it's managed. But when we got started with this, it's not something you're like, here, we're going to do this thing. You can't, implement back to what Mandy was saying. You can't just show up with a program and without ownership and support and what we always call like buy-in, right? And so we're going to offer some stats and go through them. First and foremost with Patricia here. She's a colleague and friend of counselors out of the University of Illinois in Chicago. That link goes to her. We're not going to look at that today, but that's school reentry from 2018. Some support and services she has offered to school counselors to use. And it was used as a reference and resource so that what we're sharing with you is really evidence-based. So that's a resource you can definitely go to when people in your school are like, nah, we don't really need to do that kind of thing. You can go, actually, people across the nation are doing this kind of thing. Some stats. Okay, Center for Disease Control and Prevention. There's a lot of stuff to look at there. Families, community and healthcare factors are related to children's mental health. Yes, we know these things. That means we all need to collaborate with one another, right? There's some numbers there. Children aged 2 to 8. years, boys were more likely than girls to have mental, behavioral, or developmental disorders. Children living below 100% of the federal poverty level, more than 1 in 5, had a mental, behavioral, or developmental disorder. Age and poverty level affect the likelihood of children receiving treatment. And so we know there's disparity in that. And we know that there's not equity in mental health, right? Theory. Also, ACEs, we've all learned and heard about ACEs over the years. In the 2016 to 19 survey, children ages 6 to 17, they were discriminated against based on race or ethnicity and had higher percentages of 1 or more physical health conditions. Race and ethnic discrimination was almost 7 times as common among children with 3 other ACEs compared to those with no other ACEs. There's such disparity already with mental health, and if you add any other factors of discrimination, or equity pieces, those kids are not seen, and they're our highest level of need, right? No, nope. We need Jeopardy music.
So I can either I can either change them on here so I can see them or change them up here.
Nationally and also has
Oh, resume slideshow.
I can do a dance, but you just don't want to see that. Yeah, here we go. Some other stats. Okay, adolescents, depression, substance use, and suicide are important concerns. Obviously, this is directly from CDC, of course, right? Ages 12 to 17 and 18, 19 reporting these. I'm not going to read them to you, but look at this: major depressive, sadness, hopelessness, substance use, alcohol, illicit drug. I mean, look at the numbers, they're staggering. And so it's really just, I mean, it hurts in the heart, but it's a reminder about what we are doing every day at work, right? And so what I know to be true, and what I use when I'm talking to people who are not like mental health advocates, I'm like, okay, every day we wake up with 20 spoonfuls of energy. We get up on the best day ever, we're feeling awesome, we've got good sleep, and we're well. We use 1 spoonful to get out that door and get to school or work. Our kids, with this going on, they're down to what, 10 left by the time they show up to school?
came
There's
about
another 5 just to get through the door. So we know it's disparate and it's fragmented. So they walk in the door, they got like barely anything left.
And these systems that
right?
already do that kind of screening. And so the work that I've done with Universal.
It's a little slow.
Screening
Okay,
schools
so
is
some more
that
information
then
from NAMI.
schools that were
Great organization.
to do this
So again,
work
if we
to
look at these
identify
things,
students with
particularly
mental
in
health,
Pennsylvania,
and feel free to
98,000
very
Pennsylvanians
first
aged 12 to
partners like
17 have depression.
really
1 in 6 US youth aged 6 to 17, experience a mental health disorder. Again, we know that you guys know these numbers and they're staggering, but it is important that this data is out there to look at. 1.7 million people in Pennsylvania live in a community that does not have enough mental health professionals. We're over in Pittsburgh, everyone, you know, Pittsburgh, UPMC, all these things. We are struggling to find supports for our kids. Struggling to find psychiatrists for them. We're struggling to find therapists that have openings for them. It is a crisis. High school students with depression are more than 2 times more likely to drop out than their peers. 57% of Pennsylvanians aged 12 to 17 who have depression didn't receive any care in the last year. 7 to 10 youth in the juvenile justice system have a mental health condition. Very scary stats. Again, we saw the slide earlier this morning in the keynote, but looking at these ages, the depression, the anxiety, 17-year-olds, the behavior disorders, 6 to 17-year-olds. These are huge, huge concerns. And they're with us in school every day. A lot of hours. Yeah. So the Trevor Project, talking about some of our marginalized groups, the LGBTQ, suicide is the second leading cause of death among all young people. And then the LGBTQs are 4 times more likely than their peers to attempt suicide. 4 times. The Trevor Project estimates more than 1.8 million LGBTQ seriously consider youth and suicide. That's at least 1 attempt every 45 seconds. We're here with you for 45 minutes today. Think about 45 seconds in this 45-minute span and how many youth that involves that are considering or attempting. It's frightening. And again, why are we talking about the suicide in this? That's why kids get admitted to the hospital, right? So they're getting admitted because they're attempting or because they have some really pretty significant ideation. So they're entering these hospitals, inpatient, outpatient programs, IOPs, and then they're coming back to us in the school.
Okay, we're gonna quickly move through these. Wanted you to have this data. If you don't know where to find it on websites, I know some people, we have a friend in this room who's really good at finding heat maps for us and other data points. But these are heat maps around where services are available, and data. This is pediatricians, and you can see where the gap areas are. There's some areas, and this is number per 10,000 children age 0 to 17 and how much access they have. And you can see where the disparity is. And we're gonna go through pediatricians. This is our family medicine physicians. And you can see where the disparity in fragmentation is common in rural, really rough to find.
And look at the zero, like there's
Yeah,
things
like
on here that are zero.
So how
That
far
is unbelievable. Yeah.
It's really fast. Psychiatrists, take a look at that. You know, it's just slow.
She's a little slow.
Okay, psychologists, again. So how far, so again, we're talking about marginalized populations, how far do they have to travel? And so when you think through that piece, you can go to the next one so you can see, social workers. They're not receiving treatment and services, and so we have young people who are becoming have to be hospitalized because they haven't received that treatment soon enough as well, right? So that's why these heat maps are important to see and why we need to raise, getting back to Andy's presentation, we need more people, right, doing the work.
And so we want to talk about a little bit about culture and collaboration. If things weren't great in your school before the student got hospitalized, it's going to be really hard to help them transition back and feel good and safe and healthy. So it's important for us to talk about the culture and collaboration, to have these things in place proactively. We want these things in place when they start, because coming back from a hospitalization, that's a very personal, that's a very private issue. Families, students, they're not always willing to share these details, but we need this information so that we can help them be successful when they transition back. So a positive school culture leads to, why did they move?
I know the art.
I was like, why did the arrows move?
They were super cute. He doesn't want our toes. It's awesome.
So positive
flexible.
school culture leads to positive child and youth development, which leads to effective prevention and health promotion efforts. Again, there's extensive evidence for this out there. So 4 overarching dimensions of school culture that you want to look at and think about: the structure and context, such as just the basic location, the physical safety of your buildings and what the students are feeling day in and day out. Organizational and academic, so looking at your staff development, training, curriculum, the teaching and learning, the academic performance of your school. The community, the relationships that you have with your community partners, again, talked about so much in the keynote. And then lastly, the safety and support. So what kind of prevention is in place? What kind of safeguards is in place? What kind of things do you do with bullying? How prevalent is the bullying?
Okay, so this is the stuff you want to look at, right? We just want to get all the context. You're like, yeah, we're doing it. So there's 2 pieces we're going to talk through. When we talk about re-entry, we have a checklist and a plan. We'll first take a look at the checklist, and that speaks to sort of our order of operation and how we manage that. And this is specific to our school system. And so Shannon and I will team on a lot of things, because at the end of the day, when a kid comes back, we don't automatically test them for something. That being said, 504 IP, that being said, often we're looking at that. So we are automatically looking to gather data points, to put supports in place. And Shannon sits on our staff team as well, and we meet weekly with a data team and alternate with our staff team. And so we're constantly looking at these kids. While the school counselor is the one driving this work, as far as management, we are always talking as a team. So I'll speak to a good portion of this, but just so you know how that looks, okay?
And the reality is, when these kids are coming back from the hospital, they have a diagnosis because they've been in the hospital or treatment. So it kind of sort of does trigger the child find that we know and are aware that this might be a student with a disability. So that's why Jen mentioned we are kind of watching and seeing how the transition goes. Do we need to take any further steps in terms of a 504 special ed evaluation?
And for context, we'll do a reentry plan for a child who's been in IOP, partial. If they have mono and they missed 3 weeks of school, we'll do a reentry plan. So we do this for mental health, physical, I mean, whatever it is they've been out for. If they've been out for an extended period of time, we will do a reentry plan to ensure. Yes.
So the point you may get this.
Yeah.
One of the challenges we have, I work in the rural district,
Right.
where some of this is just in our business, right? And so
Yeah, that's-
do you have some kind of process through which you identify, oh, the student has been hospitalized, the student is returning, that's something you're always aware of, and if you find out sort of mid process or after the fact,
Mhm.
maybe at a convenient time,
Yeah.
you still go back and do this.
Absolutely. and it is fragmented, right? And it'll look like out of whack. Is that an educational term? But that's what we do, right? We monitor and adjust on a regular basis, and we are flexible. But absolutely, because we really try and get, open communication and releases with anybody a child's working with. We are not always granted that. Sometimes it'll be more of an internal communication tool based on what we know. And sometimes it'll be with, can you not get to it?
So it's on my screen, but it's not up there.
We might need the warning that to help us. She
Yes,
can hear
she's
us.
listening. Yeah.
Yeah, okay.
Please, Lauren.
She's on her way. So you can pull up the documents to see, this is super fun. But it depends on the situation, right? Like, is the answer always in everything we do in our work? It depends. And so our hope, obviously, is that we are informed. But sometimes I find out at 3 o'clock that a child's going to show up at 7 o'clock the next morning. And so we scurry and throw something together. Sometimes, we have a link we can't open. Thank you.
And we have a psychiatric hospital within the confines of our district, so they are actually great about giving us information, but it is sometimes a day or two late. So we might get notification like the day after that a student was admitted, and then the same thing, we'll get a notification like the student is being discharged on this date, and we're like, oh, that was 2 days ago, where have they been? So we do have that collaboration, just because, again, we as the school district are responsible for the students that are there. Again, not all of our students go there, though. Some of them go downtown to, Western Psych or other hospitals, but we do have the one with us.
Well, I think it goes back when you think about, there's a lot of discussion about relationship building and a culture of trust. Everybody works really hard to build that. I hear you, though, not our business. We get that too. And in the cases where it's not our business, we will put together what we can and what we know and communicate with our teacher teams and try and build a collaborative support system for that child based on the information we have. We're going to talk about best case scenario. That's what we hope for, right? If we can see it, it'll be super awesome.
So the people on Zoom can see it. The people in person just can't see it yet. But we're going to fix that.
So I got it to change on Zoom, so online. I can see it.
Okay, so Karen brought up that she gets notice when a child is hospitalized. We
get notice from Southwood.
We get notice
Because I know you know. Yeah, we don't get notice from Western Psych.
And I can Western Psych, there it is, Western Psych. Yeah, it's like I have a student currently that I'm working with who's in high school, who has been in treatment heavily for an eating disorder and has been in and out. I have a personal relationship with her caseworker at this point. So my student has been in 4 different treatment times at this point. So that's like a different scenario, because I know that person really well. It's a family that has language barrier. So we always work with Trans Perfect. So I'm always on calling them to get language support. Okay. Here's our checklist. Awesome. Shannon, you're gonna slide as I go through.
I'm gonna do my best.
Okay. Yeah. Oh, yeah, did it there.
Yeah.
So this is for us, and we work in Upper St. Clair School District in the suburb, South Hills of Pittsburgh. And so this is the checklist. So initially what we put on here, student name, school contact, that's usually, this isn't gonna be me, it's my students say, right? Name of placement, that might be, let's say that this person is at, and these slides will be shared out, so you'll have access to these. The name of placement is Western Psychiatric, and then let's say if my student with the eating disorder, I would put what unit they were on if I knew, right? As much as I know. Contact of placement, that would be Lindsay, that's who I'd be talking to, so I put her name there. Dates and time of students reentry meeting. So we're going to have a meeting, whatever that meeting is, list that there. How is student being educated? So our student who would be at Western Psychiatric, depending on the situation, we would collaborate on that. They're usually given time there, but they're still doing our work. With my kiddo who has been in and out for context, we have been able to manage most of her courses. We're doing something atypical with math, because math is so scaffolded, and she's an exceptionally high achieving student. So she's currently doing AP calculus online because her timetable was a little out of whack with that. And so we would list that there. Okay, so encourage steps. So we put encourage because it depends on the situation, right? So action items. In most cases, the school counselor will take the lead in carrying out this process. And we say in most cases because depending on the situation, there are some cases, for instance, Shannon, there are some families that she works very closely with, because again, we have a very privileged setup and she lives in our office. There are a couple of families that she has a very strong working relationship. And so while we team with her on everything, there are other counselors or departments that team with her. It might be that she's the primary contact for a family, and it just might work out that it's better for her to have that conversation. Okay. So that's listed. When school staff first learns of critical incident situation, reach out to parent or guardian. So we laid out so we don't forget to do something, basically. Also, we want to build a system and a structure that isn't dependent on me knowing to do it.
Yes.
It is a system and structure that if I get really sick and I have to be gone for 6 months, somebody else shows up and can look at that and know what to do and ensure we don't miss something, right?
Or if we're both at a conference presenting
Yeah, like this, yes.
and we're not in the office.
Yeah, we're not there, right? So someone else can take care of that. We confirm with the parent where the student is, who they're working with. We get a release, so we can talk to the person at the placement. We have standard release we utilize for staff, and we set up the reentry, right? And hopefully it takes place prior to them returning back to us. We assist a student and parent guardian through absence by staying in communication. That's, again, best case scenario, everybody.
Yeah.
What we hope for. If the physician orders homebound instruction, assist with that process. We have homebound forms, of course, that are the typical ones. We talk through that. We have a kiddo right now who had a serious skateboarding accident in the summer. We talked, no reentry yet, almost taking the year off. Pretty significant, has had skull surgery. That kiddo, we coached that parent through Shannon and I, marking no homebound at this time because he can't receive anything.
Yeah.
No reentry yet, but part of this process still because we're talking with that family. Return date, again, invite the family, whoever makes sense to come in for that meeting, and we'll customize per child. We're very intentional about their safety, their comfort. Often it is just me. If it's the kid that Shannon's really working with or family of history with, again, it just depends. Following the meeting, ensure that the reentry plan is carried out, including follow-up with parent, guardian, and outside providers, of course, and any additional meetings. And you'll see with the actual plan, we have action steps, who's in charge, dates, and such. So that's like our checklist, right? I have one for when we enroll students that's very specific about make sure you get Keystone scores, make sure you get CEW, make sure you get, when we enroll kids. I'm gonna see your magic here.
He's standing at the back door, so I don't feel that stressed about it, but he showed me what to do.
It's about that checklist, yeah, of course. By the way, nice to see you.
Where do you house that document?
It's a good question.
In their permanent file. If with permission, if not.
Screen sharing has stopped.
Do teachers have access?
Yes, that's what
So, yeah.
I'm gonna show you next.
Camera.
Yeah, when we pull it up, we'll show you, because it's a communication tool. So that everybody's on the same page about what's happening. And usually we get permission. Now, if there's a situation where a family wants to go through the plan, but they don't want to.
So the next
share
thing on here.
we will draft a portions that
Yes.
can be shared, because the reality is the reentry, and this is at all levels, has a lot, particularly the high school, there's a lot of academic concerns because of credit and requirements around the unit. And other levels is a little less concerned about certain content areas, because of social promotion. However, there's still, academic concerns. So that piece certainly needs to be communicated.
Thank you.
But what those goals look like. But there's other grave concerns pending why the child was out for safety and security and wellness, right? Okay, oh, here we are. Okay, awesome. Okay, so here's our plan that we work through. First and foremost, you make a copy in your drive before you write on it. Right? Okay, thank you for smiling, because you know exactly what I'm talking about. So again, our child's name, their date of birth, their grade, for documentation purposes, and anything that exists currently that they may have. We want to make sure that that's all documented there. And when were they last in school? Was it 3 weeks ago? Like, when was that? I want to make sure that's down there. Brief description of their absence. Brief sometimes takes up a lot of space there, pending why they were out. Was my kiddo, because she's on her 4th day, she's anorexic and it's severe depression and all those things, or is it something else? Where were they? When were they out? And what education did they receive during that? I will say, if I have a kid that's in placement and I know, I sometimes start this document ahead of time because I know they've started so that it's ready to go. And it's like in the queue, if you will. And then any concerns that we're receiving from them. So that part started, we have our meeting, and then during the meeting we talk, and then they share the concerns they have about returning to school, right? And what that looks like for them. And then we have health concerns that we review. Diagnosis, medications, any providers, release if we don't have it, and any safety plan if necessary. And of course, we're in the mental health summit, right? So we're thinking about suicidality primarily right now. Social emotional. There are people who are safe. For peers, if any. Check-ins, who, how often, when is that happening? Any other additional supports for getting back into school and what that might look like. And then anything extracurricular where they might need supports, you know, if we have a kiddo that's been out for a while and they're getting back into their after school activities, sports, anything. We have an extensive marching band schedule. They practice a lot. It's a lot.
Yeah.
But for a kiddo that's been out, like they
Yeah.
they don't want to not be at that. And sometimes frankly, it's paper day, but go to band, right?
Yeah.
Because that's a safer, engaging place where they need to be. And then you know, we ensure all those folks are part of this as well. They don't have it for class. And then academics. Note that academics is their
Intentionally.
intentionally, yeah, on purpose, because that it's important, but it's not our focus. It's a focus, but it's not, you know, and that's flipped, right? Because we educate children and we're content experts. We're really cautious when we have getting teachers to talk through it that way. Hey, what do you teach? I want to hear kids. I don't want to hear math. I don't want to hear social studies. I want to hear kids. I want a teacher to say to me, I teach kids. Awesome. What's your area of concentration? Right? That's the language I try and get to hear.
This is hard for our teachers,
Yeah,
having the
that's what I'm saying.
academics be the third thing that we're concerned about. It's really hard for our teachers, and I get it, but
I get it, and
if you're not well mentally, you're not gonna be able to do anything else ever at all.
remember the spoonfuls, that spoonful thing?
Yeah,
A kid coming back in a reentry plan, they're like a one spoon.
Yeah.
They're even in the building. So I don't care with academics when the kids get back initially.
no,
Would this be the same process for a medical?
Mm,
person?
yes.
Like I said, my kid has mono, same thing.
Yeah.
You as a school counselor, are likewise leading that, it's not the nurse or anything, like you're that. Manager.
You could have the nurse there.
The nurse will be there, she'll be
Yeah.
part of the team. It's like what Mandy was talking about, like we're the hub. We
Yeah.
actually, we refer to our office, we literally are the center of the building.
Mhm.
Our building's a quarter mile end to end, and we are the center, we are the heart of the building.
We are.
We're the heart of the building. It's a long build, there's the academics, the arts and athletics.
I get my steps in every single day.
Every single, okay, but you see the academic needs there and anything that, you know, might need to happen. And then we have very nurturing, strong, assertive, bold conversations with
Yeah.
our staff about, you know, what needs to happen. Because, and for them, to their credit, they want to ensure the kid gets their credit, that gets educated.
Yeah.
In math. And I say math,
I know.
that's
Well,
hard. That's
it is. Yeah.
that's hard. Okay, and then we have our next steps. Who's gonna do what? When are we following up? What do we need to do? What does that look like? When's the next meeting going to be? Because we're always going to follow up for sure, because if a kid's been out, and by follow up, I don't mean like my check in and check out, what I mean like follow up on this plan.
Yes.
And then we get a bunch of signatures.
Yep.
So it is very formal, but it's also very nurturing. Karen,
This is amazing.
thank you.
It really is.
We're good at documenting.
And I feel like we do a lot of this because we don't do the documentation piece.
Mm.
Of course, I'm
Yeah.
sure many of you do a lot of this.
Right.
So how do you handle like so you talk about tapered attendance?
Mm-hmm.
This would be the plan for reentry. Are you modifying for, say, maybe week 1 is this, week 2 is this,
Mhm.
week 3 is this? and
Yeah,
week
that
4
document gets really long.
Okay, so do you make changes, like do you build that in at the
Is there-
beginning or
yeah,
do you
we-
see how it goes and then jump in and make the adjustments?
Yeah, so we tier it depending what we see, and if we see it's not successful, when we're working with kiddos and families, we'll adjust it. You know, ideally,
Next, but it can
it's
stay
gonna
on
be
this.
boom, awesome, it's working, they feel supported, but with like a child that's been out, they can't, and some of the tiering is they spend half the day in our office
Yes.
with us, and they're in a, we have room, we're fortunate and privileged and resourced to have an office suite that has 7 small tables
No.
and a single chair and like a round table and a desk, like we're very resourced. So we
Just advance and I'm good.
but you can, everyone can find space for a child, and we are resourced to have 2 administrative assistants that are out in that common area that can help supervise that, so the kids aren't, you know, like there's adults in them. A school nurse will collaborate on that, if they need, like, we have spaces for our kids, so we'll taper them in sometimes that way.
But I will say, along with having all these privileges and resources and supports, the expectations of our students are extremely high.
Yeah,
They are through the roof, and the kids feel it every day. We have just our slogans and our big U's like all over the building, and it says unity, success, character. And one of the kids said, it says success literally everywhere in this building. Like that's what's pushed into our heads every single day. Like, how can we not feel this pressure
And success
you're right.
equals straight A's, just to
Yes.
be clear.
in our district?
In our district, that's
Yes.
operationally defined as getting all A's.
Yeah.
And if you don't, it's terrible.
So it's a real double-edged sword for
Yeah.
us, doing the mental health work,
Yeah.
because we know how important it is for these kids to be successful and what their parents are expecting of them living in this district. But at the same time, we know how important it is for the mental health to be in check and in place. And it's hard sometimes to get through to the kids. I mean, your girl in particular, like she wants straight A's, she wants to be in all the top level courses because cognitively she's capable, but her mental health isn't okay. And it's hard.
Sorry, that
I
was,
didn't do that.
sorry, that was me. It's a growing pain.
So we will tier, so it's back to what you're saying here, we'll tier it as they come back and readjust it. I mean, it does require a lot of communication within our building. It does require a lot of really bold words stuck in my head now, bold conversations with our staff. Because you know, we'll get pushback, like they just don't figure it out. I'm like, they're figuring it out, and so do you, like, you know, and so there's this interesting, like, we can make it easier for them. I'm like, we're not, you know, in communicating that. And I say this spoonful of energy thing because that communication is heard and our staff get that, they will hear that. Or if it comes down to it, I'm like, well, if I put a big cast on their head, like, does that make sense? Like the kid has cancer.
Yeah.
And the kid's walking around with 2 broken legs, like a kid with 2 broken legs actually has an easier time in our school than a kid with mental health
Absolutely.
and
Yeah,
depression.
1000%.
Because they have to be in a wheelchair. They're like, oh, this poor kid will do whatever. I'm like, seriously, like that's easy compared to what.
We're overtime.
Oh,
Imagine that. The
Oh.
two of us talking
I
for
thought
too
it was
long.
11:15. It's 11.
Oh, I thought it was 11. Oh, perfect.
Whatever.
Never mind then. Keep
So,
talking.
thank you.
Yeah, we're almost, actually, this is it. Yeah, the wrap up. So a lot of these things we talked about kind of as we were going through, but these are some of the best practices that we have found that have worked for us in our district. A transition meeting with the sending facility would be amazing in an ideal dream world. I think I've only had that happen once at the high school with the kids, but at least a phone call, at least if you as the counselor are having the phone call with the sending facility, just to get information to be consistent. Because you're going to have the parent and kid come back and ask them, okay, what were you working on? What does your safety plan look like? They're not going to know. So to have that information from the other professional is just a huge help. Again, having the point person to facilitate that return back in our district, it usually is the school counselor, probably 99% of the time. Again, that culture of belonging throughout the school setting. If it wasn't there before, it's going to be really hard to welcome this kid back and make sure that they feel safe and secure. The check-ins need to happen regularly, like Jen mentioned. It's not just the one-off, like, oh, hey, everything's still okay. We need to follow up with the teachers. We need to be following up with the administrators. We need to be following up with families, making sure that if we think everything's going okay, that it really is actually going okay and working for them. Maintaining that open communication. Again, our hope is the transition back will be perfectly seamless and everything will be a-okay. That's not always the case. Some kids are more resilient than others and everything is fine. But if not, remember your MTSS, remember your tiered supports, think about what you can put in place for these kids in the tiered system. Again, if that's not enough, we do have to be aware they have a diagnosis. They're thought to be a student with a disability. Where do we need to go with that? Do they just need the 504 accommodations or do they need the evaluation for special education? So for Jen's girl, you know, with eating disorder, we put a service agreement in place for her the third time she came back. And for the boy who had the head injury, we issued permission to put a service agreement in place, but then we got some additional information, realized he wasn't going to be able to come back into the building and that the functioning was really going to take a while to get back. So we went ahead and issued the permission to look at a special ed evaluation, just because knowing when he does come back, he's going to need a lot more supports than we originally kind of thought and planned. So again, the collaboration on that piece to figure out, you know, what path do we need to go down?
And then if you need any backup when you're talking with anyone in your school, because like, yeah, they have to figure, again, I hear that they have to figure it out.
we
So
hear
that's
that.
why I keep saying that. I hear that. So in October of 2021, the Department of Justice from the Office of Civil Rights released a statement. Some of you have it because I shared it with you with your friends. We talked about it. But they did a fact sheet, and it was around a lot of this, students and parents and families, they're communicating to the school district that they have a mental health issue or there's some disparity there. We are required by law to follow through on that and not just say, well, everybody's upset. And we are in fact, I believe are still living in a pandemic. We still have regulations around COVID protocol in some ways. And so we do still have to follow that fact sheet. It's still valid. And that comes from, the Department of Justice. So, and that's they're thought to be a person with a disability when they've been out or someone communicates to school even before a placement, right? And so those guidelines exist to protect children so they're safe. Because here's the thing. Our job is like to save kids' lives every single day, and then we educate them too. And we're there. We're here learning about it. That's why we're all here. So there are a lot of resources that provide a foundation that allow us to do this work. We didn't start with this reentry plan, and we didn't have a foundation 10 years ago.
Absolutely.
I mean, we've been doing this together forever. But we didn't have that foundation initially to have those kinds of really uncomfortable conversations.
Yeah.
But I can say to a number of people, actually just yesterday, I had a teacher finally apologize to me because he was not nice.
He's not nice.
He's not nice.
Mostly not nice ever.
But and I have a kid who's really not been in treatment. She probably needs it. The family will not follow through on it. And so we're doing
We can't
everything
force
we
them.
can to make sure this kid stays alive. I'm worried about that.
Yeah.
And all the communication, but teachers like her work is superficial. She's putting superficial effort, blah, 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 blah. And
He told her to work harder.
Yeah. And I was like,
He told her that in an email.
but building a relationship, and because we have these systems in place, I can have different layers of conversation now with our staff to ensure we're keeping it safe.
That's a question though, because that back and forth. My perspective is, but it was just really about understand. Where we struggle with this kind of transition planning is that teacher perspective of, listen, like I get it, like, okay, the kid was gonna make by a kid with this massive car accident.
Yeah.
Had surgery, all this, and they're back, they're not back yet.
Yeah.
And teacher's like, okay, well, they're in algebra 1. We're halfway through algebra 1.
Yep.
What do we need to do? Like, what are they gonna do the work? Are they not? And what we often do, at least frustrating to me, is say, we'll just modify, remove non-essential content.
Yeah.
And it's like that golden cheese
Yeah.
scene from
Yeah.
Schitt's Creek. It's like, well, okay, modify, what does that mean?
Yeah.
And so the teachers, my experience in these conversations is often, I want to support the student, but if my expectation of my job is to teach them algebra 1, how am I to modify and respect while also maintaining integrity of my work? And so that's where I think that frustration.
Yeah, I hear this work all the time.
But in terms of like instructional support, like, how does that work in this conversation as well? Is that something the administrator works with them on, or do we say like?
Yeah.
Allow for that to happen.
So there have been some instances where our director of student support services has found us money to do some tutoring, like outside of school, after school, and called it like partial homebound. So we have had that for a couple students who, again, like for a car accident, have been out for a significant amount of time. And again, they're missing that core content, again, math, that you need to build upon. So that's one thing that we've
Extended
done.
school year,
Yeah,
adjust their whole program.
yeah. So give them an incomplete and let it continue through the summer.
That's the whole program. I mean, just the timeline.
Yeah.
My young woman I was talking about, she missed a lot and was not receiving that math instruction, but is like a 2-year ahead math kid, brilliant, all the things. So she does not take math in our school. We found an online course she could take. So we delayed it. So like she's 2 months behind her peers in math, but she's catching up. And so she did honors pre-calculus through October and then end of October. And so now she's in AP calculus online, not taking it through school. Right. And so that's not something we would not approve we don't approve our kids to take online coursework that we offer.
Right.
Because it's contractual, right?
That's like a
But that's-
plan concept of.
They
Right.
can't reentries, yes.
Yeah.
And we are problem solvers. That's what we do. We problem solve and critically think all the time as counselors. And that's something I fought for. I said, I want this for her.
Yeah.
She's not learning. Someone else is like, she just can't take the higher level class. I'm like, yes, she can. She
Totally
loves it, and I'm
capable.
gonna fight for that. And so I had a strong conversation with people at central office. I got money for her.
Yeah.
So it was paid for, because they're a family that doesn't have that kind of money.
Yeah.
But she shouldn't have to pay for it. It's our job to educate her within the realm of where she is. It's our job to meet them.
Yeah.
It's not their job to run and catch up to us. I'm gonna get going, but that's right. And, you know, and if we can, and again, we have access and I was prepared to find money somewhere. You know, I was prepared to pull it from my budget, so. If we can spend $15,000 in napkins, I think I can find money for an online course for a kid. Right? Or there's an agency or something in your community that supports kids, so. Does that, I mean, those are the strategies. And administrators will help in that conversation sometimes. What is kind of cool is our new assistant principal, the former math teacher, and she is able to really help out with the conversation because she has ideas. Yeah, she has worked with, and she comes to us from a struggling urban setting, and so they had to do lots of without funds kind of like ideas with kids with truancy issues to get them back to capacity, and she had some good ideas, so that's been helpful for us in the math. Actually, that's been helpful. Yes.
How do you communicate to parents before there's an emergency? This support's in place for them should they need it.
The reentry plans? So like holistically? That's a really good question.
Yeah.
So there's some things we have in place that like, this is not like, we didn't present this to our school board kind of thing.
Right.
If anyone's ever seen us do the gender support plan thing like that. We just do that.
We just do it.
Yeah. I mean, the school board is aware, but we didn't get it approved.
Yeah.
It's just part of our support services we provide to students and families. So, so we don't put out that we have it. We just, when we know something's going to be
Yeah, so I think through conversations, if the parents saying like, I'm really worried, I don't know what's happening.
But like I put out, we have SAP.
Yeah.
Focus, if you have concerns, please do this.
Mhm.
Yeah, that we put out.
So I wonder if this could be kind of framed in that same way. If your child's experiencing an out of school placement, please be sure to notify your counselors.
Yeah, for whatever
I just
reason.
think that could,
Yeah.
it could go. I mean, that's actually a really good idea to put it out ahead of time more proactively.
Yeah.
My sense is I've not had a kid in placement I didn't know about.
Yeah.
But so I haven't thought of that. So that's a great idea. Thank you. I appreciate learning every session I'm in. So you're not wrong. So we haven't considered doing that.
And I would say, even if we don't know why or where the kid's in placement, we know they're somewhere. Because there are definitely have been times where the families have not wanted or been willing to share the information with us, which is fine. But I agree with Jen. We usually know that someone's out.
And part of it's social media and the kids talk like,
Yeah.
did you hear Shannon Dressler went to Western Psych and then some kid like, Carl, did you know she did Dressler? And then, even if it's that way, good old Instagram.
I just want to say for the people online who I know aren't able to ask questions, please feel free to reach out to myself or Jen through our emails that will show at the end with any questions.
So I'm in elementary, which is a little different, and
Yeah.
I appreciate Lori's question about where you store, because this has been something like we keep creating like policies and procedures, and if you put it so much more eloquently when you're like, if we're here at a conference, we're like, if I drop dead tomorrow, will people know my job? I was like, that's so much. But, so there's so much collaborating going on, but in the elementary school, like, to put one of these plans in, to then have it follow them for like 6, 7, 8, 9 years, I'm like, sure.
So we do transition meetings that are fixed as part of our program. So when children leave Baker Elementary, and they go to Boyce Middle School, those counselors will have a conversation. And there could be at that time, if there is sustained health and wellness, it would be appropriate to share. To remove that, or keep that not a permanent filing number. But like, we do have some kids that there is sustained need, and it is appropriate. And especially, I will say, if it's been it's happened a couple times, we use that as a data point in their testing.
Yes.
Yeah.
Yeah. Or just as part of the history for me in my evaluation of this is how this all played out. These are the dates that they were out. This is when they came back.
And then honestly, a child, like, let's say, I know we have 1 minute, but if a child has 2 stays for mental health in 4th grade, and then is okay for 3 years, but then all of a sudden it blows up again, and we're looking at them, that historical perspective and lens would be worthy to have that to look back on that.
You just worry about the backpack that they see.
Sure, that's right.
And,
Yeah.
It's all talking about stigma and working with people who might not understand, and they think they need to know everything, but then they treat kids differently. You don't want them to do that.
It's really valid. In those transition meetings, I often say, it's important to have, I have capacity as Shannon, because we're mental health professionals, we can keep that here. And also have open eyes, open heart, open soul, open all the things when I'm meeting a kid. I can't say that is the same for all of my other colleagues that I work with. And so that information